And I am live. It is Carmen with the Bigfacs Money Show. It is Wednesday, and if it's Wednesday, I am live. This month, all month of April, I have been bringing you dynamic business women, women that are doing their things in the community, women that are giving back. And tonight, it is no different. I am Carmen Bernard. I'm located in Atlanta, Georgia. You can get in touch with me at carmen10k.com. And of course, you can just inbox me or DM me or call me or email me, whatever way you need to get in touch with me. You need to get in touch with me because I have information that you need to share with others. So you want to make sure that you get in touch with me. Tonight, we have Joan, affectionately known as Joni Leung, joining us. She will be talking about how she built her business, her personal home care business agency from the ground. And then she will be sharing some of that information with you who are looking to do the same things. That's what we're here about. We're here about sharing information and helping to build our community. And so tonight we have Joni, and I'm going to go ahead and bring her onto the stage. Hello, Joni. Thank you so much for joining me.
You're absolutely welcome. Absolutely welcome, Sister Carmen, boss lady. It's an honor. It's an honor. I appreciate you.
Listen, the honor is all mine. I appreciate you for coming on and giving of your time, because what we are doing here is just trying to build our community, trying to make sure that our community gets the information that they need to get so that they can make the decisions they need to make. And this month is Financial Literacy Month. Last month, March, was Women's International History or Heritage Month. And I thought, you know what? I'm going to bring some women on here that can talk about what they are doing in the community. And especially since I had gotten some questions like, I want to start a home care agency. What do I do? I thought, why don't I go to the expert on the field? Because this is what you have been doing for 18 plus years, correct?
Not quite 18, about 8.
Oh, 8 years. Okay. All right. Give you a little bit more thing. But you've been in the healthcare industry for a lot longer than that.
Absolutely. When I became an LPN, I would say about 20 years ago.
Awesome. So I'm gonna introduce them a little bit more about you and give you an opportunity to talk some more about yourself. But first, y'all, I want to bring on the foremost expert when it comes to healthcare insurance, all things healthcare. You already know her, though. She is the healthcare queen and my powerful sister in business that you can find us on the Millionaire Ladies Mom. But she's joining me here tonight on the Bigfacs Money Show because she has a perspective that I want you to hear as Joni speaks about the building of her business. And we are in for a treat tonight. Let's welcome to the stage Queen Aaliyah Sherrod.
Hi, can you hear me?
Yes, I can.
Thank you so much, Carmen, for just asking me to join, because this is a treat. We're going to start off a new, how can I say it? A new series of talking about healthcare and home healthcare and just lots of good stuff. So thank you so much, Carmen, for inviting me.
Oh, you're absolutely welcome. It is my pleasure to have you here. But listen, Aaliyah, tonight we have a treat, right? And if you're listening, please give this video a like, share this video to someone, because you know what? People have asked me for this specific information. That means people out there need this information. They're looking for this information. First, though, let's go ahead and share this out. So, Joni, see if you can share this to your page, but I'm going to do that as well. Let me I'm going to tag you as well. So let's go here. Let's get let's get some people on. And if you're on, share it so that some people can join us and we can give this information out that needs to be given out.
Yeah, I've already shared it to my pages.
I have also since earlier today. I did it.
Yeah, but I want it now that we're live. You know, Facebook is weird. Now that we're live,
Facebook is weird.
yeah. Now that we are live, it might not have, So let me go ahead and share it out right now because we're live right here. Okay, so hit share, and I am going to tag share now, and I want to tag. All right, guys, go ahead, please like and share this out. We are helping people here today. I'm trying to find your page exactly. How do I tag somebody? Y'all, I am so bad with this when it comes to this. But hopefully, I know there's a couple of people on already. Hopefully, some of the people have seen it. But I'm going to try to see if I can directly tag Joni's page, so that if you're the people that need this information or that are here to support you can actually see it. And Aaliyah, can you share this in our groups, please, in the Millionaire Ladies Mob group and on the Millionaire Ladies Mob page? Can you share it from your page to there? Because I didn't do that. We were having some technical difficulties with that. Text your people, Joni, and see if they're hearing us.
I text them, and I also
and see if they're hearing us.
I'm on the Facebook page, and I shared it already. I hit like and share.
Okay, good. All right, so here we go. Done. Share. Paste. Next post.
All
okay,
right.
so I tagged you and I shared it on our pages. So great. All right, good. Once again, I am talking this night tonight with Joni C. P. Leung. She has a C in there now. She'll tell us about what that means in a minute. But Joni is a phenomenal young lady, young woman. Joni and I are probably the same age, and don't say nothing about our age because we will come back at you. All right? Good. She's a married mom. Actually, she's now a widow for a couple of years now. She has 3 grown children, or she's raised 3 grown children, and she has 4 or 5 grandchildren.
It's 6 of them.
6 grandchildren. She has 6 grandchildren.
I'm
started a business. Mother.
I'm an honorary grandmother of 6.
Honorary grandmother of 6. Okay. So Joni actually is from my home country in Guyana, South America. She was born there. However, she was raised in New Jersey. And she's lived there for a long time until she moved to Florida and finally to Georgia in 2015. But this woman, you will find out, although she's told you she's been in nursing for a very long time. I'm going to ask her some more questions so we can get to know her a little bit deeper. But although she's been in nursing for a very long time, she's always had an entrepreneurial spirit. And listen, that is what we need. And if nothing taught us that that's what we need, hey, Deborah, thanks for joining. If nothing taught us that that is what we need, COVID did. COVID sure taught us that we always need something else that we are in control of, because at any time something can happen and they're saying it's time for you to go, or we can't have you anymore or whatever. And we do not ever want to be taken by surprise like that. And also, if you've listened to us in Millionaire Ladies Mob or listened to me over the past years, listened to Aaliyah, we talk all the time about financial literacy. And one of the things is making sure that we're using money effectively. And many of us do need to add something that we're in control of. So Joni started this personal home care agency. I guess this was her second business because she already had one before. She'll tell you a little bit more about that. But she wanted to have a business where she would be in control. She's in control of her hours. She's in control of her money. And so she took some steps to make sure that she did that. So Joni, welcome. Can you tell me what
thank you
in Joan CP Leung?
Well, before I start anything, I must give honor and thanks to God,
Awesome.
who is the head of my life and who controls this business, because I release it and I give it all to him. So I must give honor and thanks to God, and to you, Sister Carmen. It's an honor and a pleasure to be on your platform tonight. I know when you mentioned it to me, I was like kind of skeptical in a way, but I felt, it's more than just me. It's good to share and to help others.
Yes,
so if
right.
and people meet me all the time and they do ask me, how did you get started and so forth? Well, like you said, I was originally born in Guyana, South America, and raised in New Jersey from the age of 11. I left New Jersey in 2004, went to Florida, met my husband, and we got married in 2004. And decided we're going to come to Atlanta. So we moved to Atlanta in 2007. Been here 17 years in this same location, same house. But like you said, when I went through nursing school, I did everything in terms of entrepreneurship. I have a transportation company in New Jersey called Caring Hearts, where I took kids to school. And I also had a newspaper route. So the movement of being an entrepreneur has been in my spirit, and that must have come from my mother, because she also was an entrepreneur back home in Guyana, ran her own home care, her hair salon as a cosmetologist, and that's why the name of my agency is really from. It's developed from my mom. SHIRLEY is my mother, and NAOMI is my mother-in-law. It's my husband's mother. So I remember when we first came to Atlanta, the only thing that was on my mind, yes, I was working as a nurse. I did home health nursing as an LPN, graduated from Morris County College. Did like one semester of Essex County, but then after an LPN program was started in Morris County, and Morris County from where I lived in East Orange was about a good couple of miles all the way up the hill. But I took those hills and I finished nursing school. And worked as a nurse for probably about a year in New Jersey. But the majority of my nursing was done of course, in Florida, and the rest here in Georgia, in Atlanta, Georgia. But starting a business was driving me. I was working, making good money and everything, but I actually wanted to more help, because what I see in the home care was never satisfying to me. I feel that there should be more care given, because that was the type of nurse that I've been and always will be, to give back to people. If I had a wound care to do, I would start from the part of the wound, wash the person's feet, and complete the wound, dress the wound in a way where it's comfortable for the patient. So I always put people first in everything that I do. So that's one of the reasons why I wasn't afraid to start my own, because I'm not only doing it, you can never do this for the money, first of all. You have to have a caring heart to care for people. Because some days, you can meet all different type of people. So if you're not passionate, and this is my passion, I wake up doing this, I go to sleep, this is on my mind, so this is all I do every day. So one of the things that I really want to talk about is like the two sets of people, the entrepreneur and the family member that needs to care for their loved one.
Awesome. So we're going to come back a little bit to that, Joni. Okay. So I'm going to go back to a couple of things that you said in there, right? Number one, the one thing that I heard you say is that if you want to do this, you have to have that heart for people. The second thing is what I loved about what you said about your business, although you didn't get too deep into it, is that you paid tribute to those that were before you. Your the name of the company, even in the name of the company, it has your mother and your mother-in-law's name.
Yes.
Right? And then I see that everything that you've been doing includes that heart, that giving spirit, that giving heart. Transporting kids, you have to have that giving spirit, that giving heart, and then caring. And so I love that. I love that about you. And then you said, oh, you didn't tell us what the C and the P is for, though. And I think it's important since it's on there.
Oh, the C is my middle name, Cheryl, CHERRY, and Paris is my maiden name. That's Dad's name. And Leah, of course, is my married name. Yes.
All right, but she does go by Joni, Joni. Do not spell it wrong, guys. I made a mistake. So you make sure that you spell it right. So right now you're going to talk about two different types of people, right? That you deal with in healthcare, in your journey right now as a personal home care agency owner.
Let me say something really quick.
Yes, Ms. Eleanor.
Let me say something really quick. She mentioned this caught me. She mentioned she did not like what she was seeing in the home.
Yes.
Yeah.
Yes.
That in itself, there's so many people that don't care. They don't care. They just go and do because. But what you mentioned there, you have to like what you do, and apparently you do.
Yes,
that's what I wanted to say.
Yes, I appreciate that.
Right. I definitely missed that a little bit, but that's the thing. And having someone who is in the business because they want to create change, what they see when something is going on that they do not like, they come in and they're creating change and they're advocating for that patient. That is so, so great. I don't know what I'm searching for words right now when it comes to that, because
let me help you. Don't search for words. Let me help you.
There you go. Go ahead.
Yeah, it's very simple. Reaching out to people is so important. Because mind you, 90% of the people that you will encounter in this field, in this industry, they're sick. They need help.
Yeah.
And they're reaching out, and some of the families doesn't know where to go, what to do, and so forth. As a home health nurse, I will go to so many homes. That's why I know Atlanta the way I do, because I have serviced clients in every county you can think of here in Atlanta from 2007 to now. We're talking, what's that? Almost 20 years, about 18 to 20 years. And when I would visit these families' home, there's always a nurse behind you. One would have come in before you. And you would hear this complaint, oh, they don't care my wound like this. They don't, when they're drawing my blood, they're sticking me everywhere. And you hear all these horror stories. And so when it was time for me to start this business, I did it literally from the ground up. Policies and procedures, everything I did myself. The reason why I did that, because when you're going into an industry that, I know home health, but this is home care. It's two different entities altogether.
Talk a little bit about the difference between those two.
Home health requires a home health agency hire nurses, LPNs, RNs, physical therapists, occupational therapists, speech, and they have a doctor on board. Right. So they basically are going out to administer medication. You do medication teaching. We do everything in terms of medical, because a lot of patients are being discharged from hospitals early, They will go in for hip surgery, knee surgery, patient delivery, and so mother delivery. So when they come home, 90% of them are with a home health agency. So that's where we come in. So the home health agency can only hire nurses, professional nurses, LPNs.
So slow down for a second. One of the things you just said is that these are people that are being released from the hospitals and sometimes from the skilled nursing homes early. And part of the reason for that is that especially if they're elder patients that are on Medicare, they only get 20 days. Basically, their Medicare Advantage plan would pay 20 days in a skilled nursing home. So once they get to that 20 days, whether they are ready to go or not, a lot of them have to go because otherwise they have to pay, what is it, Aaliyah, $200 a day?
Yeah, it could be a couple $100s a day. Yeah.
A couple $100 a day. And most people cannot afford that kind of, so they ended up forcing home early. And then this is where you come in to try to continue to give them some of that care. So that's the help, the agency part. What's the home care part?
The home care, basically, that's who I am. I'm a Medicaid provider, and I'm licensed by the state of Georgia. And what I provide is personal care, PSSX, personal care extension.
Okay.
As we are providing assistance in ADL care, activity of daily living, things that people do on a daily basis. People get up every morning, they brush their hair, they comb their teeth, they do natural things.
Right.
So my agency, I don't have to hire nurses because I am a nurse. The only other nurse I need on board here is an RN. And luckily I've had an RN since 2019.
Awesome.
Like I said, what I'm doing, this is God's work, really. I'm telling you from the bottom of my heart. I couldn't do this without knowing the word of God. Because with this, there's times, this is prior to my husband passing, he was always my support, because he had said to me from the time he met me, all I wanted to do was start a business. So when I was jumping on board to get started doing a business, he never stopped me. So I always try to make sure that the kinds that we service, we assist them with bathing and dressing, meal preparation, medication reminders, because we hire like CNAs, home health aides, and PCA, personal care assistant. So these ladies are male that I would hire. They cannot administer medications because they're not nurses, but they do medication reminders. They also, I will assist in, it's PCA/sitter. The state is saying a PCA is a person who will do hands-on. As soon as you can do hands-on, you're considered a PCA. When you're walking with a patient and you're reading to them or watching TV, or you're taking them out for a walk, that's considered companion sitter. So the PCA is a companion sitter. A companion sitter is a PCA. So when they come into my office, when I hire someone, whether they have their CNA license, a certified nursing assistant, that will also work for a home health agency. Mind you, the home health agency have to have professional people. So the CNA will come on board on a home health agency, but all they will do is go to the home, the same home that I will go to, but they are just going to bathe that patient. That's all they're going to do. But my agency allow my PCAs to do more than just bathing. We assist with bathing, dressing, we prepare meals, we do light housekeeping, laundry, they can make up the bed, and they spend more than an hour in the home. We are allotted 4 or more hours.
Right.
On a day. Whereas with a home health agency, that CNA is just in that home for maybe an hour, 45 minutes to an hour.
Right.
Every client that I have or will come on board, whether they're Medicaid or they're private pay, it will have to be 4 hours or more. We cannot
Mhm.
come in the home for less than that as a home care provider. So that's the
Got
difference.
you.
That's the difference between home care and home health. Home health, the nurses come in, they spend maybe 45 minutes. Because when I was a home health nurse, I used to see 10 patients a day, 7 to 10 patients. You go from one home to the
Wow.
next. And
Wow.
by state law, I cannot stay in a home. If that wound is so bad that it requires me staying longer, then that patient needs to be hospitalized.
Right. Right.
Wow.
You know what?
Listen.
Let me say something.
Go
I
ahead. Go
love
ahead.
I love what she just said. So the difference is the home health care is medical covered by insurance more than likely.
Mhm.
Because you've been in the hospital or in a facility and now you're going home, they can come and dress the wound. Because I just had, my mother went through this. They came, all they did was dress the wound, that's it. And
Mhm.
then they left. And then there was one who came to administer IV and things like that. So that's the medical part. The
Yes.
other part that you're talking about also is the home care, where it's either you're on Medicaid or you're a private pay. That private pay, that's yeah, that's what I've been talking about. So
That's where
now
you
we
come
get
in,
the
Maria.
picture. Yeah, now we get the picture. She's important. She's an important part of this. And we're going to be doing this for the next few weeks, interviewing different home healthcare agencies and things like that, because people need to know this. It costs them money. Somebody pays for it. And that's the key. Somebody pays for it because you're not free. It's not
No,
free.
it's not free at all.
Listen, and this is what else I want to say. Listen, you guys have been hearing Aaliyah and I talk for 3 or more years now about the the activities of daily living.
Mhm.
Now we have a professional in here that actually does it. So you can really understand, especially if you're a caregiver, especially, and listen, do not leave, because Ali and I have some additional information to share about what you can do to help with those costs, what you can do to prepare for those costs. Remember, we talk about money. We talk about financial literacy. That's how to use your money effectively. We're
Mhm.
talking about how to plan your money, plan for your money so that it works for you when you get to this stage that Joni is talking about. Now, here's the thing. The activities of daily living. You've heard us talk about this. Joni mentioned bathing. Joni mentioned dressing them, right? But there are 6 of them. There's bathing, there's dressing, there's eating. That's probably if someone cannot eat, it helps them with making sure that they can eat.
It's called
There's
meal preparation.
Okay.
yeah, there's transferring, being able to get up. We take things for granted, y'all.
Yeah.
Being able to move yourself from the bed to a
Mhm.
chair,
Right.
being able to get up and move,
Right.
transferring, being able to actually use the bathroom, toileting,
Yeah.
Yeah.
Toileting.
you know, and then there's continence. Now we talk about these things, these 6 activities of daily living, of which if 2 of them, if you are unable to provide to do 2 of them for yourself, would
Mhm.
trigger what is called chronic benefits.
Mhm.
Chronic because it's chronic disease. And we
Yeah.
talk to you about protecting yourself with chronic living benefits, where
Yep.
you're able to access that if
Uh-huh.
something were to go wrong with you through the use of a life insurance agency,
Yeah.
through the use of a life insurance policy, y'all. We're talking about a new type of insurance. We're not talking about you having to die to use it, because you can't use it when you die. Yes, we want you to have it for your family, but this we're talking about is being able to use it when you need Joni services.
That's
Mhm.
right.
When
Well,
you need
actually,
someone to come in and help you bathe, eat, toilet, dress, transfer, continence. That is what we are talking about and we've been talking about. And I am so happy, Joni, that you are here to kind of complete the picture. Because what you're telling us is that people come home from the facility, they're not able to do these things. What's going to happen to them?
This is the reason why we are more than four. This is the reason why we are more than 4 hours, more than an hour a day. It's impossible to care for someone because remember, a patient that's in a facility, a nursing home facility, that's what families has been doing. They have been bringing their loved ones home. If they're not already, if they're in the facility, they're bringing them home now because the treatment that they get in the nursing home is not the same as they will get at home. So and we as Caribbean people, we don't really put our loved ones in a facility. But sometimes
say that again. Say that again. Most Caribbean people don't.
We don't do that.
I've heard that before.
If they do, it's because, of course, they have to keep their 9 to 5 to keep a roof over their head and to keep a daily bread going. So circumstances will cause people to have to put their loved ones in a facility. But 90% of the time, we don't like to do that. So therefore, when they're in a facility, we bring them home. But mind you, when they're in a facility, they cannot pay out-of-pocket. Their out-of-pocket expenses is really, really bad.
There you go. That's number two.
$500 a day. So
that's number two.
So there's Medicare and Medicaid. Now, Medicare will pay for a certain part of their care, but Medicaid, that's allotted by every Georgian, no matter what part of the United States you're located. In every state, there's Medicaid that's federally funded to every state in the United States. So some people say, oh, I don't need Medicaid. I make too much money. No. As long as you're at a nursing home level of care, you're a senior, you're already, no matter what your income is, no matter if you have millions of dollars, you're entitled to Georgia or New Jersey or New York's Medicaid. Medicaid is funded by the federal government, and it's allotted to DFACs, or in New Jersey, they call it DIFAs, because DFACs take care of foster and adopted children. So the state gives the Medicaid to DFACs. So if you want to need a Medicaid card, you have to go through DFACs. Now, that same Medicaid is what home care we can use, and that's who I am. I'm a Medicaid provider.
Yeah, well, I'll tell you this, though, Joni. One thing though is that, and we talk about this on our show a lot, right? Medicaid, believe you me, you are absolutely right when I said that there are people who get Medicaid that got millions of dollars, but they have taken some steps to protect it because Medicaid has what is called a spend down. So a lot of people go into retirement without a plan, and their plan is Medicaid will take care of me. Well, it's not really going to take care of you unless you spend down or unless you did some other things to protect that money and protect those assets. Because even some people, when they realize that, oh, I got a lot of money, they will take their money and give it away, give it to grandkids and this and that. Medicaid will make you go get it back before they will pay a cent. They will go get it back. Additionally, Medicaid, especially if you have a home and things like that, depending on circumstances, and something happens and you pass, Medicaid will claw back and put a lien against that home and get all that money, what they think it belongs back to them. So you are absolutely right that there are people, what we should say on here, because listen, guys, we do not give advice, but we do share information. So what we will say, though, is do not disqualify yourself.
Right.
Go and apply and let them tell you no. And different states, different states operate differently. And so you may be able to qualify for Medicaid in one state, whereas you can't qualify for it in another state.
Because each state has their own
Georgia,
guidelines. Because each state has
yeah,
their guidelines.
exactly. The state
And
of Georgia, especially,
exactly.
the state of Georgia did not expand Medicaid. So
Right.
we have a lot of people that, although we have Medicaid and we have the Affordable Care Act, Obamacare insurance,
Mhm.
and we have Medicare, and despite we having all those things, there are many people that are still going uninsured in many of the states. So I just wanted to make that a little bit clear, but you're absolutely right. People should not disqualify themselves. Go ahead and apply and see how you can help them. I want to go back a little bit though and talk, because I specifically got a question with from someone about how do they this is helping everybody, y'all. We talking to people who want to get the information, but we also talking to people who want to know how to get into business, Joni. So how does one start a personal home care or personal care home? I don't know.
No. Well, there's a big umbrella. It's a huge umbrella. Yeah.
Okay. Talk a little bit about that.
Before I take you to the entrepreneurship section, let's explain to some people that when your loved one is home and you feel that you could probably care for them, but all seniors require 24-hour care because most of them are disabled some way, some form. And they're used to caring for themselves, but they're not able to care for themselves. So we have to remember that we cannot leave our seniors alone in a home. Such as we have a 1-year-old or a 2-year-old, we cannot leave an infant at home. That senior become like a child. Whereas if we can get in a whole lot of trouble leaving a 2-year-old, even an animal in a home by themselves or in a car by themselves. So we have to picture in our minds that a senior is no more than like a child. And DFACs protect children. The ombudsman protects adults and seniors. That will become a legal thing, leaving a senior in the home. If they're in a facility, they require 24-hour care. If they're in your home, they also require 24-hour care. But the state is saying, why should I pay you to take care of your loved one? But we will assist you. That's where home care came into play. That's why I could open a place like this. And that's why I tell a lot of people who wants to start the business, you got to educate yourself. And if nothing else I did was educate myself. So that a lot of people will have a consultant to come in and open up your business. I warn people, yes, get the consultant to come in, but go onto the Georgia or whatever state website and pull their manuals, like I did, flip some pages, do some highlighting, and read.
That's a great
it will
bit of advice.
Save the day, because when the state comes in, and we have state survey annually. I just had mine on the 20th of March. And when they come in, you have to be readily available. If they ask for something, you have under 7 minutes to give it to them, or they can sign.
Let me ask you a question. So are you is this in a home is what you're talking about? Your home? Or?
No, I have a home office. You see, that's another thing. A lot of people that start these businesses, they'll go into posh, fancy, 18-story building and pay a whole heap of money.
Okay.
I have never had an office outside of my home.
Okay.
It was not necessary. I've assisted 3 people to start their business and brought them back into their own home. As long as you're a homeowner, you cannot live in an apartment and have a home office for home care. because you have to go to your county and get a business license. And the business license have to be zoned for this area. Now, I don't have clients in my home. So therefore, all I have is a home office. And I chose the largest room in my home to make my office so I can have applicants to come in. So we have to understand, that's why I say you educate yourself on what you want to do. I want to open up a business. There's personal care homes. If you have a personal care home, you can lease a property and start, a personal care home where you can have 6 or more people. Mine is a lot different. So then I go back to what I'm saying. You bring your loved one home, you need to know the difference between having them in the home and someone to care for them. So that's why I sat and did my policies and procedures to get my Medicaid ID number. You have to be in business at least a year before you can apply for that. With the Medicaid ID number, that means that now I can accept Medicaid clients, not Medicare. Home health agencies mainly can accept Medicare Part A, Part B, and Part C, or whatever. Carmen, you understand more about that, but Part A and Part B of Medicare than I do. So I don't have to worry about Medicare because I'm just a Medicaid provider. But under the Medicaid, it's a big umbrella again. So because the loved one is in the home, and the state is saying, why should I pay you to take care of your loved one? But they'll say, we'll give you some hours of time to go to work, 9 to 5, 8 to 4, whatever, or just to get a leisure away from taking care of that loved one. So they allot them 4 or more hours. Most of my clients get like 7 hours, 8 hours, or whatever. So the hours that they will get, it will come under, it's Medicaid, but it go under the 2 waiver programs that's called CCSP or SOURCE.
Yeah.
If you ever hear a person or a client has CCSP or SOURCE or is qualified for CCSP, that means that they're getting home care. Mm-hmm. That's the same Medicaid. Because remember, we have nursing home Medicaid, you have hospital Medicaid. That same Medicaid ID number is like a social security number that remains with you wherever you go in Georgia. But wherever you are, like when they come into home care, that same Medicaid ID number now has to change for home care. And they're under the CCSP or SOURCE program. SOURCE.
You are a wealth of knowledge. See, now what do you, so do you teach this, or are we just talking about this right now? Are you going to start teaching it? Because that, my dear, that is something that you could literally take on the road and teach.
Yep, another source of income, because you become now a coach for personal home care agents, a personal home care agencies or whatever. So we might have just spun off another whole new career here for you tonight.
Well, thank you. I appreciate you. But no, truly, that's why it's important that you teach. You see, it's important that you teach people, because a lot of people, they call me up and they want to open up a business. I said, you got to educate yourself. And that's what I did. Late night studying, highlighting, I did it, by the grace of God, of course. So, like I said, the 2 waiver programs, what makes them different? What's the difference between a CCSP and SOURCE program? The difference between the 2 are, one, the CCSP, it depends on what income is coming in from SSI, Social Security. Because most seniors, if they don't have a lump sum saved somewhere or an annuity, right, Ms. Carmen? Talk to me.
That's right.
If they don't have an annuity, but they do have SSI coming in. Now, that's where the difference between the CCSP and the SOURCE program on the Medicaid. They have to have a Medicaid ID number to be approved for the CCSP or the SOURCE program if they want home care. Because that's how I build. We don't bill directly to Medicaid as a foster adopted mother would. We bill directly to SOURCE or CCSP. So if the income...
I'm going to stop a little bit because we're getting really deep into that. If you guys want to know more information, first of all, if you have a senior that you're taking care of and you're like, wait, some of this information may help me, I'm definitely going to have you have Joni give out her number so you can contact her about it. And or reach out to me, or if you're in Arizona or wherever else. Aaliyah is licensed in every single state of the United States.
Where's Miss Eleanor? Miss Ella, where are you located?
I live in Arizona, but I'm licensed all over. Yeah, I'm licensed.
She's licensed in every single state. I am licensed in about maybe 15 states. So you can still reach out to us and we will get you in touch with Joni or whomever. But this is what she's talking about is what we do every day, because we run into seniors. We help to take care of seniors every day. And sometimes we have to refer them out to Source or to CCSP. And then that's when those people go to Ms. Joni. But I know now I'm gonna, if somebody comes to me before I send them to Source or CCSP, I'm gonna send them to you first. So
it depends on if the income is above $800 a month, between $750 to $800, they will be qualified for CCSP. If it's anything below that or low income, for a lot of low income seniors, that's when they're approved or eligible for Source.
As if somebody could really survive on those numbers. But anyway, know that information is out there. We are here to guide you in the right way, right place if you need that information. So please DM us. Please like and share this show so that someone else later can be looking at it. They can hear about this. I don't want us, normally we don't go too long. We may go a little bit over, but I want Aaliyah to talk a little bit about how we can help people to utilize your service. And that's why I'm saying we can help to grow your business, because literally these are the people, your clients, your ideal clients are the people that we deal with. And the people that you deal with, the families of the people that you deal with are our ideal clients, because we need them before they're disabled. We are typically getting a lot of calls with the person is so sick and now they want to get a plan that will help them to pay for your services, Miss Joni. But we literally have that available, but you can't call after the door has been opened. You got to call before. So, Aaliyah, I want you to talk a little bit about
Let me ask Miss Joni one more thing. So most of the people you're talking about are seniors, but they don't necessarily have to be seniors, correct? They are. You have them all over the spectrum. It could be just a younger person that had a traumatic injury.
38 years or older.
My gosh. My heart goes out to people because they don't understand that you could, I have a friend, he was so excited about getting his home and he's on his ladder. He's outside of his home doing some stuff, which he shouldn't have been outside. Fell off the ladder, life changed. Car accident, life changed. It doesn't have, injuries and illnesses don't have an age to them. But see, we're kind of specifically targeting seniors, but it could be anybody. So we just want to be encouraging. Joni, you are, I could tell your heart is in it. You are a wealth of knowledge and you passionate. That's what we need, people that are passionate about what they do. And you seem to be very passionate.
For the Medicaid, if they're younger, then they're on a gap. They get a gap insurance for the younger children, that anyone that's younger than 28 years old. For me, I cannot accept a child that's younger than 28 years old.
Okay.
It's 28 years or older under my Medicaid program. So that's what I'm saying. If you want to become an entrepreneur and want to come into this business, you have a passion, you want to really start a business like this, make sure you know what entity you want to get into. Do you want an agency? Do you want a personal care home? Do you want a group home? You got to know exactly what you really want to do.
Wow.
And if you're going to have an agency, then if you're going to do younger than 28 years old, then you have to be able to apply for that gap insurance to be able to bill on the gap insurance. That's different than Medicaid.
Totally different.
I can bill on the Medicaid because the age of clients that I service is 28 years and much older than the 80s, 70s, and so forth. And most of them are disabled, but they don't necessarily have to be disabled. They need assistance. And it must be, in order for them to come to I'm a non-medical home care agency. So therefore, we assist with medication reminders. So most of these clients that are home, they have to be able to communicate. My aides cannot change a Foley bag, colostomy bag. We could empty a Foley bag, but we cannot change a Foley bag.
Oh my goodness.
So we have to know what we're doing. I tell a lot of people, don't say you want to go into this business because Tom and Harry's in the business. Know what you're getting into, because a lot of people will start these businesses and then they collapse after a year or two because they didn't realize. And then you have to do a business plan. You have to be able to put a business plan together, because there's going to be expense. Because, for instance, if like one time it happened since I've been doing this business, that Medicare didn't pay that week, and we're talking the amount of clients that I have now where Medicare don't pay, I have to go in my pocket and pay my employees. My employees get paid every week. They don't care whether you got paid or not. They just want to get paid every Friday.
That's right.
So you have to build your capital, know what you're getting into, what the cost effect is going to be. When you start the business, you have to have an office. You need office furniture. You're going to have expense.
Right.
You know what I'm saying? And you gotta know, most of my employees are now W-2. I have to pay unemployment taxes. I have to pay federal tax for my employees. So it's more than meets the eye, in a sense. So there's the business part, there's the business part, and then there's the home care part. So if you have a little medical background, it helps a whole lot, because I can read a doctor's note. Many people can't read a doctor's note. You know what I'm saying? So with that being said, when you go to open up a case, I go out. First I used to do it by myself, but then when I hired my RN, now she does everything. Because mind you, the Medicaid, the home health agency, their care management agency, they act like a nursing home. Because mind you, if the client is in a nursing home, they're going to get nurses, doctors, CNAs are going to be in a nursing home. When they come home, they're still on the what they call nursing home level of care. They still require nurses. So who I communicate with when they're home is that same glorified home care agency that are now a care management agency.
Wow. For you guys. Wow.
For me. So the client calls me and they need care. What I'm going to do, I'm going to see, can you pay out of pocket? I try to make it affordable. Because like I said, for me, it's not about the money. I'm going to make it affordable for you if you have to do private pay. Now, if you already have a Medicaid ID number, that is glory. That's beautiful. So what I do, I reach out and I send a referral over to a care management agency. I have a list of them. There's about 10 or 15 of them that I have personally that I deal with. So I will send a referral over to a care management agency. Because that care management agency acts like a nursing home. They're going to send the nurses out. They're going to call their doctor. And they're going to go in and assess that client to see if that client is approved for either the CCSP or the SOURCE program. Mind you, on my end, my processes for both of them is the same thing. Why it differs with a care management agency? Because mind you, if you go into a facility, if you own a property, whatever assets you have, you're going to have to give that to the nursing home. Okay? All right.
See?
But if you're home,
oh my gosh.
If you're home, they still look at those assets. But the difference, they're going to say, okay, maybe you might have mortgage to pay, you might have your utility to pay. They're going to take that into consideration that you're home now. So when that care management agency come out, they're coming out with their nurses, their social worker, their physical therapists, their doctors. They come into that home and they do a complete assessment on that client. Once I send in the referral, it's gone. I don't look back. I don't. The families that call me and ask me, "Oh, I didn't hear from them." I said, "It's out of my hands." When the client is finally approved, and that takes about 120 days or more.
What?
That is not a. This is the reason why, if you know you're coming on board with my agency, I tell you up front how long it will take for it to process.
You're gonna have to pay up front a little bit.
If you want service today, I'm gonna go in myself and my buddy should be sitting here too. Anyhow, we go in together and we make it affordable for the family. Because mind you, we may give them maybe 4 days out the week, but they have to be, my aide has to be in there for 4 more hours. Because none of my aides wants to go in. They said, Miss Joan, I'm not going into no home for no 2 hours. So we have no other alternative or no other choice but to charge you from 4 hours or up. But I do make it affordable until your CCSP or source is approved. Once it's approved, that's when I will hear from the care management agency. They're going to send me something and say, Mr. Jones has been approved for CCSP. Once he's approved, they send me all the documents. I get documents come to my email for one client from pages 1 to almost 100.
Oh my God.
But I'm going to pull what I need from that 100 and something. I know what I need because I need ICD codes. When you went into this business, you have to know what an ICD code is. In nursing, you know that. If you're not in nursing, you don't know that. Hey, you have to read the doctor's notes because all these pages are coming to you. You got to take those pages. You got to call the family. Now you got to go out and assess these clients again. I have license on my wall that when the state comes in here, they need to see there's certain things in each one of my clients' files that is required for me to operate a Medicaid client. Because remember, these Medicaid clients are state protected too.
Right.
They are very state protected. So with that being said, and I'm going to wrap this up. If they need more information, like you said, they're going to either call, text, or email. But the most important thing is that you got to make sure that as you are with you finally got the clients in there, they're now approved for the CCSP program, and all these pages are coming to you. Most of these agencies are not going out and do the complete assessment because we still have to do nursing. You still have to have a nurse. There's a part of there's a comprehensive nursing assessment sheet. On that comprehensive nursing assessment sheet, we have to do the vitals. We have to read the diagnosis of that client, the medication. We have to go through each one of their medications, what nutrition they're on, if they're ambulatory. So you want to do a home care agency. It's not as easy as people would think it is.
So,
I'm not saying that I am the smartest and I'm the only one who can do this. You can do it. Go right ahead. Free country. Set yourself free. Do what you want to do. But just remember, when you're doing it, you got to remember. My phone rings all the time. I have so many people, because we used to, when I first started, we had to go to the state and we used to have in-services for the providers. And a lot of them, because we would do like networking, we would exchange phone numbers from each other. So after you're in the business for 1 year, then you could apply for your Medicaid ID number. That's when a lot of them hit the fan. Because they're not ready for a Medicaid ID number.
Right. But Joni, this is what I want to ask you though, right? And it's really important. One of the biggest things is making sure that you educate yourself and knowing about the business, knowing whether you really want to do the business. But for someone who wants to do personal home care, it does help if they do have some kind of medical nursing and stuff in their background. But what's the next step once they've done that? Give us 2 or 3 next steps for that person.
For the person that wants to do a personal care home or a
personal care home where they have a home, like you mentioned earlier, maybe they leased the home, they bought the home, and they want to have 6 or more or 6 people in that home. they maybe have they've been working in as a CNA before. They had their nursing stuff, but I think I heard you say they didn't necessarily have to be licensed for that,
Who,
but
the
they
owner? You mean
uh-huh
the owner of the facility?
yeah
Who,
yes.
who doesn't have to be licensed? The owner that will
I'm asking you, right? So if someone wants to start that personal care
care.
home, right?
Okay.
They want to have like 4 people in their home or in what some home that they designated. I'm sure they have to go and apply and get licenses, and people got they got to come and make sure that the home is okay for them to bring in people and all of those kind of things. That's why I wanted you to talk about what are some steps really quickly.
Well, first of all, they cannot be living in the home. That cannot be their
Okay.
personal home. They're going first. A couple of years ago, you're going to have at least 3 people in your personal home, but now it's down to 1. You're going to have 1 person in your home where you live. So that's the first thing you have to have. You have to find a name of your business. Then you got to find a location. Then the business, the county that you're in, you cannot be more than 1,000 feet away from another personal care home.
Okay.
So if you're gonna go and buy a home, just don't go and buy that home. If I was a person that's going to open up a personal care home, I would first go to my business license office. Whereas you're gonna go to the business license office and say, look, I want to purchase this home on 123 Avenue of the East or on Tom Jones Street. Make sure that there's not another home on Tom Jones Street that's running a personal care home.
That's awesome. Good information.
Because the state would even come in and license you. They'll come in.
Wow. Well, that alone right there is some good information to share, and why we think that in addition to all you do, you should now become a coach for these people that need to know this
people
stuff.
will pay for it.
Because people will pay money for that. You can even do some digital documents to share with people because people need this information. If they're asking me and I know nothing about it, that's why I brought you here. Trust me, people want to do that. Phyllis says, do your homework. She's right. And then you've gotten some nice comments on here. I wanted to kind of point out. They said you're on point. Wow. You're an expert in your field. Somebody was amazed that you could read a doctor's note. Someone said they love your frames and that you're looking and sounding great. Oh my goodness. And they said, go sis, great information. So good information. A lot of people are watching you. Hey, Harris, thank you so much for joining us tonight and tuning in. Listen, this was a
rewarding. It's a rewarding business. It's
a lot of information, though. We want to thank you because it was a lot of information, but I cannot let you go before you have so much information, right? I cannot let you go before I have Aaliyah just talk a little bit more about how, those people that haven't been approved for this or may not ever get approved for this. Aaliyah has a solution for those people.
Carmen, she just blew me away because when I talk to people, I've been going live a lot and talking to people about be prepared for if something happens to you. Who do you want to take care of you if something happened and you can't take care of yourself, like me, for instance, or something like that. But we have, as agents, I've been researching. My husband was really, really sick, and I found a policy for him because I knew I wasn't going to be able to take care of him. I knew I couldn't take him to the toilet and I couldn't do all that stuff. So I decided I want somebody to come in and I want to pay them, but I didn't want to pay them out of my money. So I searched for policies and home care policies, home health care policies where there's daily costs, there's weekly costs, that these policies will pay for you. There's hourly policies. And there's so many different avenues where we can pay for your services, and you're just in one state. I'm in Arizona. There are senior centers everywhere here. They are everywhere. Everybody, there's snowbirds that come in because it's warm weather. And the policies that I'm talking about are inexpensive, but they pay for a lot because what you just said, if you have a home, they want your home. I caught that. You have a home. I don't want to give my home away just because I need care.
Right.
I want to have, I don't want that. I want to make sure that I prepared and I didn't get long-term care. Let's say, I'm just putting myself in other people's shoes. I don't have a long-term care policy. Well, guess what? We've got home care. We've got life insurance that has the living benefits. There are so many things that we can do as a community or as a family to make sure our loved ones have the care that that person needs. And someone like you, we search out for people like you. We search for people who are caring and compassionate and take care of our loved ones. And that's why a lot of us end up doing it ourselves, because there are not people like you that are in every state. And I'm going to interview a couple people in California and another lady on the East Coast who do what you do. And we need to know these people exist. They're compassionate. And we also need to know that we can pay for this before we need it.
If you have long-term care insurances, I can't really accept long-term care insurances, but what we can do, some long-term care insurances, you might know that, Ms. Carmen, because the long-term insurances may have it depends on what the amount that you pay for that insurance. It may cover a little bit of your home care, but I will charge you private pay, give you an invoice for you to send to that long-term insurance, and they may refund you some of the fees that I charge you. But I can't the only insurance that I can accept, and they need to know that too. Entrepreneurs need to know that in this business, Medicaid. So as soon as
they're going to go on Medicaid,
they have to be Medicaid provider. If you're going to make it in this business, you have to become a Medicaid provider. Okay. But that's the only thing home care can accept.
So, Joni, that's exactly what we're talking about here, right? In the fact that we have things that will pay the person individually so they can now turn around and pay you.
Exactly.
And we also have something that's actually separate from long-term care that allows you to be able, because there some long-term care policies, depending on the policy,
it's supplemental, like supplemental. Supplemental insurance.
Well, sort of, right? But they only pay directly to a nursing home. So that's why we talk about prepping, right? Because there's different policies, different plans for different things. We have a level of care. Different level of care, exactly. We have plans that you can choose that will actually pay that person from your business, Joni, come in and pay that to pay them 4 hours a day, or pay them 6 hours a day, or pay them 20 hours a week, or what. There's just different things for you, and it's based on your budget, what you want and how you do it, right? Then there's actual long-term care that if you go into a facility, that they will pay that facility. Most times they do not pay directly back to you. Some of them have where you can send an invoice, like you were just saying, and then they pay that, they pay you back after you have paid. But we also have things like living benefits, which pays you directly. Granted, most of those have a waiting period, right? And you can't wait 6 months to get care, but at least if you have something that will be that will cover you for that first 6 months, like a home care policy. We have it. It's called a home care policy.
Yeah.
Not a home care policy.
Is that separate from? Would they pay for that separate from their regular insurance?
Oh yes.
Oh, okay.
Oh yes. Let me tell you, and Aaliyah is the queen for this, right?
Okay.
She does. You can have a policy that's separate from your regular insurance for cancer. You can have it for hospital indemnity. You can have it for home care. You can have it if you went to the emergency room. You can have it. It does so. You pay a couple of dollars now, and that's what I don't think if it went over your head when Aaliyah said it. Instead of you paying out of your pocket, you put a couple of dollars, you pay a couple of dollars, pennies on the dollar for someone else to pay for that later when it happens to you.
Mm-hmm.
But this is what we've been preaching, because so many people become, regardless of age, become disabled, become unable to take care of themselves. And then family members want to help sometimes, not all the time. They want to help sometimes,
but they just can't.
Their own families. And
mm-hmm.
And so they can't give up the job, or if they do, now a whole family is suffering or whatever to take care of one person, when this is preventable. That's why.
The personal care home, I don't think the personal care home can also accept it long term. So that person is going to have to pay out of pocket to a personal care home as well. And hopefully that insurance that you're talking about will reimburse them for what they would have to pay out of pocket. Because families don't want them in a nursing home. They don't want their loved ones in a nursing home. So they'll put them in a personal care home. But mind you, the personal care home, most of them cannot accept that long-term.
So that's why our policies are policies that pay you directly, and you get to do what you want to do with that money. And that's what we've been trying to say. That's what we're saying. And tonight our viewers are seeing the behind, the things we've been talking about. They're seeing what you're now saying. This is the actual job that you do, and it's not free. And it is expensive. And I know you're telling them, yeah, we make it affordable for you. Yes, but you got to pay employees, right?
And you can't do 1099 employees. See, 1099, you might be, you don't have to do all that, but now there are laws about 1099 employees.
Yeah, no, most of my employees are W-2s.
Yeah, so I love it. Miss Joni, oh my goodness, Miss Joni, you are just a wealth. I mean, a wealth of knowledge, My
employees are all W-2s.
Somebody,
they have maybe 2 of them are 1099, but everybody else, yeah.
Somebody has endorsed Ilya and I. They said, Joan, you need to sell an ebook with all the necessary steps to open your home care agency.
Help her do it. Get her out there.
There you go. So we really want to have you back. It is 9:42. We have to go on and get out of here. But I wanted Aaliyah back on here because Aaliyah does this all the time. And what we do is pay for your services. We help people pay for your services, because not if they're going to need it, when they're
going to need it. Yeah.
That's what we do. And so I definitely wanted her to be here. Listen, y'all, thank you so much for joining us. We will be back on tomorrow. We are going into part 2 on the Millionaire Ladies Mob, going deeper into health insurance. Last week, we barely touched the surface. And tomorrow night, we are probably going to touch a little bit more of the surface. But anything that we have shared on here is not meant to be advice. We're just giving information. I want you, Miss Joni, to tell us your phone number, and I'm going to type it in here of how someone could get in touch with you if they needed more information. So what's your phone number?
770-778-8993.
You're on Facebook too?
This is the business number, right?
That is the business number, and I have 4 different numbers. So.
She's like Putin. She's got 4 phones, but so that number on there.
That one is suffice enough. Yeah, that one is
all right. And so not only is Miss Joni has to start thinking about how she can increase her income with some additional digital sales, but I also advise her to get a business Facebook page. She does have a personal Facebook page on there.
And believe I don't do much advertising. When I started, I had 1 magnet on my car. So that's why I tell you, this is God's work. And just 1 magnet, and I don't do much advertisement. It's word of mouth, because we go in there, and even my aides are very caring people.
Nothing better than word of mouth.
That's because I share a passion with them when they sit here to do an application. You come to do my application, I tell them, take the whole day because my application process is about 5 hours or more because you got to watch a video. You have to take a test. So it's more than meets the eye. So on one end, I am very passionate in terms of the employees that I hire. And also when they get into the home, I'm in there the first day that they go in there.
Wow.
So if you're going to do this business, you come to me and ask me, what should I do? I could only teach you and tell you what I do.
Right.
Exactly. We need her in every state.
Yes, we need you to duplicate yourself in every state. We will be having another show. We'll have some additional healthcare agency owners on with us because this is such an important topic. And we are showing you.
A lot of them don't do what I do, so I don't know. I'm not going to say much. When they're on, if another home care provider is with me, my story is a little different than most people.
That's why we want to bring it, because it's different stories, different states, different everything, you know. And so, and then it's more where we're actually talking about what home care, what caregivers can do, and not just caregivers, what caregivers can do so they don't end up in the situation that they're now in with their loved ones. So because we are in the business of prevention, and then once we're past prevention is then when we pass that business to you, Miss Joni. Aaliyah, any parting words?
No, just this has been very informative. We our members and our viewers, they need to understand that life happens. Life happens sometime, and some things you just can't avoid. If you are living and you wake up every morning, you are going to age. It is just that fact. You are going to get to 80 or 90 if you wake up every day. And young people have to realize that. So you got to start thinking about these things because you're not going to be young forever.
Your husband, your wife, your father, your mother, your sister, and your brother, they all are going to age. All of us.
That's exactly right. No one escapes life alive. I'm sorry. Okay. Miss Joni, any parting words for our viewers?
Well, I must say it was a pleasure. I never put myself out there. A lot of people don't know what I do. They see you going back up and down. They don't know what I do. Because I don't, I can't brag about what I do. I have to show you what I do. You have to see me in action. And the people who see me in action say, oh my God, even as a nurse and now as a home care provider. So my parting words is that, hang on in there with your loved ones. You can't give up on them. And remember, you need help because you can't weaken yourself taking care of your loved one. Because that's what happens to a lot of people. They love their loved ones. Yeah, you do it, but you cannot do it all for yourself. So that's where we come into play. You see, the funeral home don't come to you. You go to the funeral home. The hospital don't come to you. You go to the hospital.
She said a word.
I step back and I don't tell people what I do. You got to come to me. When you come to me, then I will show you what I really do.
Wow.
Remember, you cannot do this alone. You need help. You don't want them in a facility, clearly understand. But remember, you need help. And in every state, there's some help somewhere.
All right. Miss Phyllis says you cannot pour from an empty cup. That is definitely true. And although we come to you when you need the facts, you need to come to us. And this is Carmen with the Bigfacs Money Show. And all we do here is give out the facts. Nothing but the facts, ma'am. Have a good evening.
Have a good night. Nice talking to you, Miss Ella Sharon.
Aaliyah.